World Sight Day takes place every year. It's the second Thursday in October, so this year it's on the 12th of October, and it's really the single biggest moment and opportunity to raise awareness about the importance of eye health globally. What we're trying to do is to reach as many people as possible with messages about how important eye health is, how important it is to look after your eyes, to be aware about the kinds of conditions you might have and where to get eye care. We're trying to increase the numbers of people that we reach. So last year, we know that through social media, we reached over 500 million people on World Sight Day. This year, we're aiming to reach even more. This year's theme is about the world of work, and it's really an opportunity to engage both employers and employees about how important looking after your eyes in the workplace is, both in terms of employee well-being, health and safety, but also it has real productivity benefits as well. There are a number of ways that people can get involved across World Sight Day. Firstly, we're looking for people to pledge to get their eyes tested. This year we're aiming for 10 million pledges. Last year we got over 6 million, and if you want to pledge and get your eyes tested, you can go on our website, ipp.org. The second area, which is linked to our theme of World Work, is having vision screenings in workplaces. So last year we held vision screenings in a number of parliaments around the world. This year we're encouraging businesses all over the world to hold vision screenings for their employees. We have a whole load of resources for workplaces and employers, and then we have our Love Your Eyes glasses and all our social media activations. This year a report was published, done by Deloitte, sponsored by one of our main partners, Roche, on investment in eye health to prevent sight loss. And this was a report looking at essentially the cost benefit of investing in eye health, and why actually investing in eye health is a good investment, because the impacts it has are not just on people's ability to see, but actually has broader impacts around economic productivity and people's ability to participate and contribute to society. The report came up with 4 broad areas of recommendation. So the first area that it identified was often the lack of data, particularly at a national level, around eye health and eye care. If you're not collecting data, you can't tell whether you're improving, whether your services are improving or not. This is particularly important because in 2021, the World Health Assembly set 2 new global targets on eye health, which were improving the effective coverage of cataracts provision by 30% and the effective coverage and refractive error, eye glasses, by 40%. The second area was around the crucial importance of leadership, and particularly developing national plans and policies. And we see that's quite patchy around the world. We do see some areas where there have been good policies. Nepal, for example, has recently published a really excellent national plan on eye health, which it embeds those targets as its targets for what it wants to improve. But actually in too many countries you don't see them. I think increasingly we would be keen to make sure that eye health is in fact included in national health plans. So it's not just out on its own, but it is really properly integrated into overall health policy and planning, so that you then get access to the resources you need. Related to that, and this will be something that will, I'm sure, be familiar to many people, is the lack of workforce and the need to invest in workforce. And the report calls for significant investment in programs to develop and strengthen the workforce. I think crucially you need to develop the skills you need at every level, particularly in primary care in many countries, that you have access to primary eye care skills, and therefore we invest in both professional training but also in supporting generic health workers in being able to identify eye health problems as well. And then the final recommendation was around investing in preventive interventions and early stage interventions. This is obviously really important, that the sooner you can pick up conditions, the better. Just one area to reflect on is diabetic retinopathy, where if you can pick that up early, you can really prevent significant sight loss in almost every case. But too often people aren't aware that that's a risk, and that's both in terms of patients and professionals. So it's both about having the services available, but also raising awareness, which is why days like World Sight Day are so important in terms of actually raising awareness and making people aware of how important their eye health and vision is. We would obviously encourage all optometrists, as many optometrists as possible, to participate in World Sight Day, and again, go on our website, iapb.org, and there are lots of resources there.